impact, but I will turn to Dr. Moore on the rapid test component. Thank you.
Thank you, Minister. And just in response, I think the most important message I would have for our communities is that we achieve the highest community immunization rate we can achieve. I'm so happy to announce today that first doses are 80.5% in Ontario, and our second doses now are 70.5%. So we've done remarkably well through a non-mandatory means of providing immunization to the population in Ontario. We have a ways to go. We're calling that last stretch of trying to achieve near 90% as an ultimate goal, the last mile, and we will work diligently with our local public health agencies and communities to try to achieve that. Keeping a low rate of infection in our communities is how we keep our schools, our businesses, our social settings safe, and that is best achieved through that high level of community immunity. So congratulations, Ontario. We're on the right track, and we certainly want to achieve higher rates over the coming months. It's never too late to get immunized. The other question about asymptomatic testing using a rapid test is when our community rates are very low, like they are now, there is a significant risk of rapid testing being a false positive when you have a very low rate of infection. And then you need a confirmatory test through a PCR. And so we've reviewed this issue with Public Health Ontario, local public health agencies, and it has been their scientific advice to us that rapid testing for asymptomatic individuals and low community rate of infection is too burdensome and will have too many false positives and be cumbersome to implement. And so we're maintaining that robust testing strategy using PCR, as the Minister has said, a multimodal means of providing PCR testing if someone is symptomatic, and that is our strategy going forward, to have assessment centres that are accessible, quick turnaround times for parents to be able to have their children back in the classrooms, and using a multimodal method of testing.